America may have the worst response of any country in the world to this pandemic. It's close. You could argue that Brazil, Russia, Turkey, possibly some of the data out of Russia and Turkey are a little less reliable, but certainly Brazil has had a response as bad as ours. But those are the main countries. We're doing much, much worse in most ways compared to Western European countries, compared to Southeast Asian countries. And but when you look at the US response, there are actually two responses in one. Parts of the United States have actually done quite well. They look a lot like Western Europe, being hit hard early, locking down aggressively, keeping case numbers reasonably low. About a third of the US right now is in reasonably good shape, whereas another third is in very bad shape, and in a third, the middle third could kind of go in either direction. So a lot of variation in the United States. Second big point is that it's very tempting when you look across the globe to look for explanations for why other countries are doing better. And I've now done enough of these panels and conversations that I've heard completely opposite theories. One is, for instance, that authoritarian countries do better. Except I started off saying countries that are doing poorly include Brazil and Russia, so that's not really consistent. There are some people who say, well, it's actually cultural and East Asian countries do better. Well, a lot of East Asian countries have done very well, but so have certain European countries. So I don't believe that there is something kind of inherently cultural about certain countries' responses or their people that makes it easier. So seriously the virus has been taken. We have had an incredible amount of misinformation spread often through social media outlets like Facebook. We've had a political and leadership, both at the federal level and at many state levels, that have largely adhered to that misinformation and promoted that misinformation and have failed to take science as the primary guiding principle. Look, it's a pandemic with a virus. And so this is almost all about biology and math. And if you decide you're going to ignore both the biology and the math of this virus, it is unlikely that you'll end up doing very well. And that's what we have seen pretty consistently. Third big picture point is that you don't have to be a wealthy country to do well. And if we had been doing this session a few weeks ago, I could have made the case, and I'll still make the case. But 3 or 4 weeks ago, I would have said Vietnam, one of the kind of absolute standouts, has not had a single death. Well, in the last couple of weeks, they've had a couple of large outbreaks, and now they have had a few deaths. But it's still trivial compared to what has happened in the US and in many other places. So does Vietnam have access to some therapies that America does not? No. They don't have any new special diagnostics. They certainly don't have a vaccine. So what is different about Vietnam, what is different about Taiwan, and let's talk about Vietnam because it's not as wealthy as Taiwan, is that fundamentally they have taken a very aggressive approach to this virus. They shut down their travel early with China. They've screened people coming in. They've had a very aggressive contact tracing regime. So there's a lot that Vietnam has done well to keep the virus under reasonable control. What's important is that the Vietnam approach is actually pretty different than the South Korea approach, which has really relied heavily on testing, which is pretty different than the New Zealand approach, which has relied largely on lockdowns, which is pretty different from the German approach, which has been this blend of many things, which is also different from the Japanese approach, where they haven't done a ton of testing, but they've had universal masking. So what's my point? My point is there is no one way to deal with this virus. There are 4 or 5 major tools we have. You have to deploy at least one of them really, really effectively, and the others become a supplement. You can almost pick which one you want to deploy. In the US, we've done a half-hearted approach to a whole bunch of different things, politicize things that clearly have no basis being political, such as whether people should wear masks or not, and have had a whole lot of misguided, non-science-based policy implementation that has landed us where we are. So let me just finish off by saying, as I look to the future, the weeks and months ahead, the fall, the winter, into the spring of 2021, and I agree with Dr. Jha, by the way, that we will not have a vaccine that's safe, effective, and widely available in 2020. I think that is highly, highly unlikely. But in 2021, we might. I mean, we will in 2021. I'm pretty confident, and we will. My hope is in the first half of 2021, but not necessarily much before that. Okay, so as we look out, let me make one last point, which is to think and realize that America is a very heterogeneous country, and I expect that different parts of America will do very, very differently. And there will be parts of America that we can point to that will look every bit as good as Europe. There will be parts of America that we will point to that will look every bit as bad as Brazil. And fundamentally, what we're looking at is 50 different pandemic responses in the middle of a global outbreak. This is no way to run a pandemic, but that's where we are as a nation. And I think America is going to continue to muddle through it with enormous amounts of suffering and death until we get to a point where we do have a vaccine. The vaccine won't shut everything off. It's not going to be 98% effective, but it has real potential for substantially slowing the spread of the disease and bringing the pandemic under much better control. So that's the future ahead of us. Obviously, things can change if policymakers decide to get serious. There are plenty of lessons to learn from abroad, not one, but the single biggest lesson is to take the virus seriously and let biology and math drive the decision making.